Oh my goodness, I've just read this article on the BBC about this cancer and maternity hospital. So not only is it massively delayed, I think twice over budget, but they have basically, the builders have messed up big time. Loads of water damage, not dried out, put panels on. They've then found mould. Some really key documents weren't completed right at the beginning, which could have avoided all of the costs and everything else. And they've had the experts in. They've had Professor Malcolm Richardson, who I believe now is retired, but he was at the Manchester Centre for Mycology Research. So at least they've got a mould expert in there, which is good. But what we are seeing here is what we are seeing everywhere. This is not a situation in isolation. So generally, builders do not understand moisture in fabric. So they don't understand what that does in terms of the microbial contamination and then what that does to air. And that's why we created the UK Centre for Mould Safety, because it's about people understanding what moisture and what water in the fabric of the building does to the people that are within it. And the most painful part, can you hear Zephyr snoring? The most painful part of all of this is that they're talking about the one of the places is for people having bone marrow transplants. Now, what happens is when a person has a bone marrow transplant, the body naturally, the immune system naturally tries to reject a transplant because it's alien, it's not mine. You're adding something to my body that shouldn't be there. So what these poor patients are given is an immunosuppressant. So it basically tells their immune system, calm down, don't worry, we're looking after you, and please accept this bone marrow transplant. So these people's immune systems are basically shut down, and then they're going to be in an environment which has got all of this microbial, volatile organic compounds that they're going to be breathing in and will be impacting their health. And this is a national health crisis. We are dealing with the biggest issue. I would say, this is far greater than COVID. It's far greater than cancer. And actually, if you have a look at microbial contamination, like aflatoxins are carcinogens. So, maybe it's the mold and the water damage in our homes that's causing the cancer. We have to take this so seriously. And what we need builders to be trained up on water damage in buildings. The UK Centre for Mould Safety was created for exactly that. So we've got a global standard training session, which is a 3-day session, water restoration technician. It's how to understand if something has been water damaged, what you need to do in order to make that building safe for the occupants again. Public buildings have a far greater responsibility for keeping people safe. Obviously, NHS buildings do. But the public building it's somewhere people have no choice but to go. Let's say a school, a hospital, a library, sometimes a leisure centre if children are going for swimming lessons, etc. These buildings have to get it right. And the greatest thing is that we will go to this hospital, so where the authorities are saying that this hospital is going to be safe, and when it's opened it will be safe. There's nothing stopping people like me, citizen scientists, going in there and actually doing mold testing just to basically check that people are safe to go there. We cannot accept anything less than safe when it comes to our indoor air.